according to the World Economic Forum of COVID Action Platform, it is estimated that globally over 450 million people suffer from mental illness. Mental, neurological and substance abuse disorders make up 10% of the global burden of disease. And an estimated one-third of all people with a mental health disorder have never sought treatment. Now, these statistics, however, are from the pre-COVID-19 era. One can only wonder what the numbers look like now. Joining us to discuss the effects that the global pandemic and subsequent lockdown has had on people's mental health is clinical psychologist Benedict Mhlongo. A very good morning to you, Benedict. Thank you so much for joining us.
Good morning. Also, good morning to your listeners. Thanks for having me today.
Now, let's just talk about some of the numbers. I mentioned a few of the statistics that we had just before COVID-19. Do you think that there's a much larger quantity of people who are suffering from depression and, heightened anxiety and all of these mental illnesses post the lockdown? It is day 100.
No, I think actually there's a huge surge of actually increase towards this pandemic. Actually, people are feeling very much isolated. So you must also understand that once we feel very much isolated in our rooms, in our homes, we have the inability to perform who we are in terms of our social, even our cultural practices. They're also being distorted in some form. So mental health is actually on the rise now. People feeling a lot of depression, people feeling very much isolated, people feeling a lot of anxieties. So it's very much problematic right now that people need to take care of their health.
And also some studies show that depression, actually suicide is is the second largest cause of death in the country, especially in people aged between about 15 to 29. Why do you think such young people are so prone to suicide?
Also, just to go deep on those stats, actually, it's mostly amongst men, preferably black men, actually. So there's a lack of inability for us to actually have sought out mental health in that regard. So young people, for instance, in the teenage phase, they're all about creating their own identities. There's a lot of things that actually are involved when somebody actually is coming of age, when somebody's actually creating their own identity outside of the family system. So there's a lot of pressures that are actually faced or imposed upon this person. And the most fundamental basis at that particular stage is the basis of comparison. People compare themselves. These young people are actually comparing themselves to, my friend is achieving this, look at this, their family, our family does not have this and this. So those are the major contributing factors to that. It's just comparison. And it's actually killing us.
So how then would you advise some of the men who are watching us right now to actually deal with this issue of trying to compare yourself to others and just feeling pressurized even though there might not be a specific pressure from somewhere?
Yeah, the pressure may actually come from or arise from cultural practices where a man should actually be like this or in this regard. So therefore, if you're not performing socially or a performativity of you being a male is actually seen or frowned upon in society. So how to actually best advise anybody going through that phase is just actually acceptance. So the mere fact, or when you start accepting your own condition or your own situation, therein will lie your power. They will actually be able to be present and try to actually negotiate your own spaces and certain cultures or certain places that you find yourself in. So it's all about acceptance. That's the first stage, actually, in any type of life struggle that anybody should actually face.
And would you say that some other people that do suffer from mental illnesses could have a genetic disposition to it, apart from whether you're male or female?
Yeah, that's the unfortunate part. For instance, if you come from a family that are actually prone to depression or any other neurological disorders or biological factors, actually, you're prone to actually do get not diabetes, but it's the same. Hereditary factors are also into play in that regard. So your depression, even your borderline type of personality disorder, even your high mood disorders, like also your psychotic ones in terms of your schizophrenia. So there's actually a very large correlation when it comes to hereditary factors that actually play a very pivotal role within the family or a household. Because imagine if mama is also very much depressed, mother's always expressing an element of depression or an element of loss or giving up in life. So I'm also going to have to actually take that up because mom and dad are the first worldview or the first actually access to what life actually is or the world is actually how it's actually structured. So if that is already distorted in the system, in the family, so therefore it's inevitable that I myself will see the world as the same.
You've mentioned that sense of, giving up, the sense of hopelessness. What other ways can we identify if a loved one actually is slipping into depression?
Yeah, it's actually quite key for us to actually have certain elements that can actually see that. Listen, for instance, if you have a family member who enjoyed reading, for instance. Now the family member has actually lost interest in things that they've actually previously enjoyed. Family members already is always up around your 1 a.m., insomnia, things like that. The family member sleeps forever and ever and ever, wakes up quite late, complains about headaches, back problems, and wants to be isolated at all times. And I understand that, for instance, in the black society, we're not prone to be very much open and social, but the mere fact that one's keep isolated. So we need to demystify this notions of actually saying that, Los Panbanus Tulela, this person likes to keep to themselves. We need to actually make them more social, make them actually speak about certain problems, because you'd find that there's problems within friendship circles or relationships for that matter. But we need to just create a system or a culture of being openness.
And then with the lockdown came some restrictions on the sale of alcohol as well as cigarettes and tobacco products. Do you think that some people who are addicted to these products have also slipped into some sort of anxiety as a result of not being able to access that thing that they're addicted to?
No, I certainly think, because we must understand that addiction can actually come in any form, for instance. An addiction should not actually be said that it's actually hazardous or dangerous, but the mere fact that you're not only prone to that type of addiction, it's also an escape, it's also a self-care type of activity. So people actually not actually now, it's actually impinged or forced upon. Like, for instance, if you have somebody who's suffering from depression, the first thing you say is that stop, or the first thing that you not need to say is that stop, this is actually harm you or anything, or a suicidal person. You can't say things like you have a good life or anything. So imagine now that I was addicted to this particular substance, but I'm actually now forced to actually stop that. There's going to be a lot of withdrawal symptoms that are actually quite negative to the human nature, or to their own routine that they were actually used to before the COVID-19 or the lockdown or those restrictions were actually impinged. But they need to find other self-helping or coping mechanisms to actually try and replace the addiction of maybe substance abuse or substance use for that matter. So there are a lot of things that can actually people find refuge or solitude in terms of psychotherapeutic interventions also.
And just lastly, if you can just expand on how to actually approach those loved ones who are getting suicidal or who have slipped into depression, some do's and don'ts.
Yeah, like a very big don't. If you have a loved one who's expressing suicidal symptoms, they don't need to actually be told that, listen, I'm here, you have everything that you need in this household, you have a great job, you have a nice career, you have family. They don't need that. They already have explored those things. So it's like stating the obvious to them. All they need at that particular time is just care and acceptance, and actually say that, listen, what you're going through, we can understand, we can relate, even sharing certain life experiences that one have actually experienced themselves. So just supporting them at that time, just to be open. Remember, the main theme here that I want to actually people to take from home is that let's be open. Let's actually be open to a point, an idea of actually let's speak about certain instances where we have problems, whether it's in the household or outside, but we need to create a culture that we speak about problems.
Well, thank you so much for joining us this morning and giving us those insights. That was clinical psychologist Benedict Mhlongo.